Good morning, everybody. Thanks to the nearly 32,000 people that came forward for testing in the last 24 hours to 8 p.m, and that is a good result. The numbers continue to hold up in terms of testing, but we do need it to go higher. As Dr. Chant has said, the more people that get tested, the more opportunity we have to control the spread and to make sure we're not missing any links of transmission that may exist in the community. In particular, to those Western Sydney suburbs we mentioned yesterday, we do know that queues are gradually growing there this morning, but whether you're in Auburn or Berala or Lidcombe, in Greystanes in particular, we want that area in particular to get tested. And of course, following yesterday, we're encouraging people in the very south coast of New South Wales, given that infected couple from Victoria who are in those locations, to also make sure they come forward for testing. But the message is, no matter where you are in New South Wales, if you have the mildest of symptoms, come forward and get tested. Make sure you're constantly looking at the venues that health puts up in real time, and make sure you stay home after you've had the test until you're advised otherwise. Overnight in New South Wales, we had 7 cases of community transmission. 4 of those are from the same household of an existing case. And but for one, all of them can be linked back to a case that we've announced to date, and the 7th is under investigation, and hopefully health will be able to establish a link in due course. I want to stress today that New South Wales very proudly has always managed to balance the health risk, plus providing security and support to our citizens, plus providing confidence to business that they keep operating in New South Wales. On that basis, we're very keen to make sure economic activity continues. But before I talk about some existing restrictions that we want to extend in Greater Sydney, I would like to say thank you to the patients for the people in the Northern Beaches communities. For those in the southern zone, from midnight tonight, you are officially part of Greater Sydney. So thank you for respecting the stay-at-home provisions. But for all of you who live in the southern zone of the Northern Beaches community, including Minister Hazzard, you will now be treated as part of Greater Sydney. So thank you again. And please know that whatever we announce for Greater Sydney is now, you are now subject of. You do not have to comply with the stay-at-home provisions you were subject to until this point in time. Thankfully, according to the health advice, the risk of transmission in that part of the Northern Beaches has dissipated, and in fact, as I foreshadowed yesterday and the day before, there is a greater risk at this stage of community transmission in parts of Western Sydney, which we are obviously trying to get on top of, than there are in that southern section of the Northern Beaches. Dr. Chant will provide some further statistical information on what's happening in the northern part of the Northern Beaches, and for that reason the stay-at-home provisions will be staying at this stage until the 9th of January, but I can say with some level of confidence that that is pretty much the worst-case scenario. So following the 9th of January, we anticipate people living in the northern part of the Northern Beaches will also then become part of Greater Sydney. And again, in particular, we want to thank that community for your patience, in particular businesses who are doing it tough. And I can confirm today that the Treasurer and other ministers are liaising with the Chambers of Commerce and businesses to see what support, if any, we can provide in the ensuing weeks. Now, I want to stress again that the strategy in New South Wales is to keep life as normal as possible, but also to make sure we maintain and even increase economic activity. So we are thinking about what happens in the next few weeks and the next few months. The Crossroads outbreak took us about 4 months to get to zero community transmission. We certainly don't want this outbreak to take as long as that. We've learnt from what's occurred previously, and we're very confident in the strategies we have in place. But today, we will be announcing further restrictions in Greater Sydney, and I'll go through them now. And I thank the community for your patience, but also say that our strategy is to make sure that people can go about their daily business with as little impact as possible. However, there are certain settings we're putting in place which will be effective from midnight tonight. The first one, which we've been talking about for a long time, is strengthening what we're doing in relation to wearing of masks. So masks from midnight tonight will now be compulsory in certain indoor settings, and we want to be very clear about this. We'll be making sure that compliance or enforcement occurs from Monday. So we won't fine you until Monday. The fine will be $200 for not wearing the mask in these settings. But if you're going shopping or in shopping centres, you have to wear a mask. If you're catching public transport, you have to wear a mask. If you're attending an indoor entertainment venue like a cinema, you have to wear a mask. places of worship, hair and beauty salons, in gaming areas of establishments, and staff at hospitality venues. Now, none of this will be a surprise. We'd already strongly recommended mask wearing in these settings, but what we want to do is to make sure we're not in a situation where we're restricting people's ability to go about their business. In fact, we want to increase economic activity, not diminish economic activity, and mask wearing in these settings will ensure we have the confidence to do that. Also, when we're hosting major events, or when we're undertaking other activity, or when people are going to work, having masks on public transport will reduce the risk of allowing people to go about their business. And this is why this is a good time to do that. We've learned during the pandemic that we had to actually make stricter restrictions earlier on in the pandemic. We don't want to ever go back to that situation. We want people in New South Wales to be able to go about their business as much as possible. But we also need to reduce or mitigate the risk in certain settings where we know there's challenges, and that's why these indoor settings will now require mask wearing from midnight tomorrow. However, we won't enforce that until Monday to give everybody time, but it wouldn't be a surprise to anybody. We've been talking about this, Dr Chan and I and Minister Hazzard have been talking about this for months and months. But the strategy, because many people will say, why now? And the reason why it's happening now is because we want to make sure and give confidence to business and to people who are holding down jobs that you can continue about your activity in New South Wales so long as you wear a mask in those indoor settings where there is a higher risk of transmission. In addition to that, we're reducing gym classes back down to 30. Currently it's at 50. I don't think there's any surprises there. No nightclubs, no surprises. You can't dance or sing at this current time. Weddings, funerals and places of worship, we are reducing to 100 at this point in time. And of course subject to the 4 square metre rule. So if there's a venue that's smaller, it'll be less than 100. So we are capping weddings, funerals and places of worship back to 100. And again, we want to prevent any super spreading events which will put New South Wales backwards. Outdoor performances and outdoor activity, which is less controlled, we're reducing to 500, down from 1,000. And in terms of controlled outdoor events, we're reducing that from 5,000 down to 2,000, again, to mitigate the risk of any super spreading events. Now, in relation to the SCG and the cricket test, I want to confirm today that our health officials, police and the event organisers will be doing a walkthrough to go over the COVID safe plan, and health will continue to make further recommendations if there are any adjustments to the COVID safe plan. I've spoken to the event organisers and police are also aware clearly compliance is an issue. On paper, plans are fantastic, but you need to make sure they work. And today, health will be going through the venue with the organisers and with police to make sure that that event is as safe as possible. But this is an example where the New South Wales government strategy is to keep jobs, to keep community morale and wellbeing, whilst making sure we're COVID safe. And we feel in New South Wales we can continue to strike that right balance and to make sure we give a sense of normality to people's lives. I also wanted to stress that in regional New South Wales, none of the settings will be changed at this stage. However, having spoken to the Deputy Premier and other colleagues and obviously based on the health advice, at this stage we are strongly messaging people to make sure they're COVID safe, especially as there are a lot of tourists in different communities. To date, the sewage testing has been negative in the regional communities, especially those areas where there's a high number of tourists, and we want that to remain the case. We do know that in some parts of regional New South Wales there is slightly more complacency because of their remoteness. However, we ask everybody to make sure you're COVID safe in regional New South Wales as well. I also wanted to stress that for the purposes and definitions of health, when we talk about Greater Sydney, we are including Wollongong, Nepean Blue Mountains and the Central Coast, and that's according to the definition we've been using to date, just to make sure everybody is clear on what restrictions they have to abide by in their own communities. I'll hand over to Dr Chant now to give her update on the cases, and then Minister Hazzard will reinforce some of the things we've talked about today. And can I also briefly say that in the next week I will be taking off some leave, and it's not something that I like to do, but something I feel I should do to make sure I'm at the top of my game, having not had a break in 18 months. But I want to assure everybody that I'll continue to get the daily updates regularly, and if there's any cause for me to come back and be on deck, I will. But I just want to thank everybody for your support and appreciate your understanding. And I'll see you all in a week, if not beforehand. Thank you.